Good morning, everyone. It's my pleasure to be able to give you this talk on AI nuclear medicine, current state and future trends. Unfortunately, circumstances transpired against me and I was unable to attend. So thanks to the organisers for enabling me to give this as a recorded talk. And I hope you've been enjoying your conference so far. So first of all, let's take a look at what AI is and some of the terminology used around it. First of all, artificial intelligence itself is nothing more than just a concept. There's nothing tangible to it. It's just the idea of simulating human intelligence by machines or computers. But within AI, we have the term machine learning, which is actual mathematical techniques and tools which we can use to program computers to enable them to learn patterns in data so that they can make predictions on unseen future data. Now, a specific version of machine learning is deep learning, which is a newer, more complex version of machine learning, which uses these mathematical equations arranged in complex networks called neural networks, which are broadly inspired by the way our brains are wired and how our brains learn to recognize patterns in the data we receive through our senses. So you may also have heard of other terms like computer vision and natural language processing, which is the phrase behind large language models. Now, these are just implementations. These are versions of machine learning, or deep learning as a version of machine learning. So this is these techniques, these mathematical tools in practice. Computer vision is obviously applied to image data, whilst natural language processing is applied to written text and is the backbone of large language models. So before we go ahead and look at AI nuclear medicine and where we're at, let's see how we got here in the first place and look at a brief history of AI. And believe it or not, AI is nothing new. It started back in the 1950s when Alan Turing, in his seminal paper, said, "Can computers think?" And in 1956 at the Dartmouth College Conference, it was the first time that the phrase artificial intelligence was actually coined and used. And from this point forward, a great surge in interest and investment and research into developing AI played out through the 1960s. But unfortunately, apart from a few little notable things like a chatbot being developed, in the 1970s and 80s, we went through what we affectionately refer to as the AI winter, where there was very little interest, very little progress of investment and research. However, in the 1990s, particularly in 1997, a bit more interest came about, and as I say, 1997, the Deep Blue algorithm beat the world chess champion. So it was the first time a computer had beaten a human at chess, and this was when people started to take note again. And in the 2000s and 2010s, due to the advent of the internet becoming more established and availability of large amounts of data, so big data, and the increase in computing power through graphics processing units, GPUs, off the back of the gaming industry, these three things, so connectivity, big data, and processing power, really enabled some of the techniques and mathematical techniques that were developed back in the 50s and 60s to be brought to the front again and actually implemented on real life data. And in 2017, we had a bit like the Deep Blue thing with the chess champion, the AlphaGo algorithm beat the world AlphaGo champion, Chinese champion, and it's been a bit of an exponential growth since then, really. And we're now in the 2020s, which is being labelled as the era of generative AI, which is a specific form of AI where instead of predicting outcomes on learnt patterns in data, you're just creating more versions of the same data you've seen the patterns in, which is the things we're seeing with large language models, as well as graphical generative AI. So now let's take a quick look at what you can apply AI to. Well, in the first instance, you could look at the start of the patient pathway with procedure planning, so things like patient selection, patient scheduling, and preparation. You can then start looking at areas of optimization of the procedure, so tailored imaging protocols, dose optimization, and scan time reduction. Then moving further along the pathway, image reconstruction AI could be used in corrections and enhancement. And then when it comes to interpretation and report generation, we can look at things like pathology detection, auto-segmentation, so contouring of organs, image quantification, or automated report generation even. And then finally, the last step of that is clinical decision support. So disease characterization, prognostication, outcome prediction, and those kind of things. Now, when it comes to the currently available AI tools in nuclear medicine, I wanted to quickly share with you some key results of the Institute of Physics and Engineering and Medicine's AI group survey that I led in late spring and early summer of last year, where we got over 400 responses and found that nearly 50% of medical physicists say they're routinely using clinical AI tools in nuclear medicine, and just over 30%, nearly 32%, of those use cases were in segmentation, so on auto contouring of organs. And here we can see some of the companies and products that people were quoting in that survey as using, obviously from companies like GE, Siemens and Hermes, but also some smaller AI startup firms like Pear. And obviously lots of segmentation use cases, but a couple of reconstruction use cases and workflow automation and anatomical landmarking. Taking a look at some of those individual tools in detail, here's the offering from Hermes, where they use the CT data on PET CT to auto contour normal organs like the liver, lung, spleen and kidney, as well as doing some processing of the myocardium. So similarly, Siemens can do auto contouring on the CT for the lung, but they also have an offering that can identify and automatically contour suspected lesions on the PET functional radiotracer data. And alongside these two tools, they have the platform Aiden, which has multiple functionality that's AI driven built into it, where it can help with anatomical landmarking, protocol range setting, respiratory motion, image preparation archiving, and even assisting with multi-parametric PET. Now, on the radionuclide therapy side of things, you've got two offerings for Y90 Certsvith dosimetry planning from MIM and Murata, which is using auto contouring of on the CT for liver and lung outlining, which saves a lot of time rather than having to do these large organs slice by slice by hand, and improves consistency of dosimetric calculations as well. Similar to Siemens Legion ID, the startup company Pear have a tool that enables suspected sites of focal uptake on F18 FDG PET CT to be identified and auto contoured, and for it can generate a summary support report of analysis like total metabolic tumor volume. And if you do it on 2 scans, pre and post therapy, or just progression monitoring, it can perform generate a summary report of changes between the two scans in terms of tumor burden and SUV changes. And moving on from segmentation tools to reconstruction tools, there's really two main offerings currently in the market. One from GE, which is their precision DL algorithm built into their new Omni Legend PET CT scanner, which helps enhance the quality of the outputted reconstruction. And Subtle Medical's vendor neutral tool, Subtle PET, which again enhances the quality of the reconstruction, but could be applied to any PET CT's data. And these obviously pose the potential to either decrease scan times or decrease dose, or a mixture of the two, and regain the same level of image quality that you might desire. So as you can see, there is a handful of AI tools out there on the market for nuclear medicine as medical devices, albeit mainly dominated in the segmentation domain. But I wanted to take a look next at what's out there in the research, what might be coming next, what's just over the horizon. So I did a quick PubMed search using some key terms, and this is the result I got in terms of numbers of publications per year over the last 10 years. And you can see there's a very steady increase year on year, and it looks like 2025 is going to do the same again. So I'm just going to take a quick look now at a very small handful of cherry-picked papers that have caught my attention over the last 6 months or so. But this really is a very small personal selection and not really a deep dive into the literature as a whole, because we don't have time for that today. So first of all, here we have a deep learning neural network applied to F18 FDG PET CT scans of lymphoma or lung cancer patients, where they're using the neural network to try and classify uptake and grade the uptake. And sort of similarly, you've got this group here applying a multimodal deep learning algorithm to PSMA PET CT scans on prostate cancer patients, where they're trying to predict pelvic lymph node involvement. Moving on from PET CT to SPECT CT, here I find this really interesting, this idea of using machine learning this time, not deep learning, applied to myocardial perfusion SPECTs to select patients that would only need a stress-only scan. So you don't need to have that second rest scan appointment there that you might not need at the end of the day. This is actually selecting patients who only need the stress scan to try and help with throughput. And really excitingly, from my point of view, being in specialising in radionuclide therapies, is this decision support tool for lutetium PSMA therapy patients, where they're looking at the baseline PSMA PET CT scan before the patient start therapy, and they've got machine learning algorithms looking at the data from the PET CT images and seeing whether it can actually predict how well, if and how well, the patients will respond to lutetium PSMA therapy. Staying on the therapy theme again, we've got a whole body voxel based internal dosimetry algorithm, deep learning, applied to see if you can do voxel wise dosimetry using deep learning rather than traditional methods that we currently use to calculate doses in therapies. And finally, looking at dynamic PET scans, where instead of having to do a whole 1 hour dynamic scan, which is obviously quite hard for the patient to stay compliant for that whole hour keeping still, you only require a portion of that, say 10 minutes or half an hour, and the algorithm learns how to predict the next bit of that time activity curve for each voxel. So essentially you don't have to acquire the whole time series that you would like to get dynamic data for. You can only acquire the first portion of it, and the algorithm will predict the rest, which is quite an exciting prospect for research purposes. So whilst those papers provide a tantalizing glance into what might be just over the horizon and coming our way as AI tools in the near future, I'm gonna get out my crystal ball now and look even further into the future and try and take a bit of a speculative look at some of the blue skies stuff that's out there that might be the disruptive technologies of the far future in nuclear medicine. And the thing that really sticks out in my mind when I look at this is the era of generative AI that we're living through now is starting to look like it's being applied to medical imaging in the form of what is called image synthesis. So this AI-driven image synthesis can be either within modality or cross-modality, which gets really exciting. And there's this nice review paper which looks at the current work out there in this image synthesis domain. For example, and this image lifted from that paper shows you can have now MRI scans being converted into CT scans. You can have PET scans creating their CT scan equivalents. But what's really quite exciting and potentially disruptive for nuclear medicine is the idea that you could generate PET from other forms of data. So here you've got MRI being converted into PET. And there's even now a company who have gone on to see if they can generate PET from CT scans. And they are Radicate, I think that's how you say it, at least anyway. And they are currently they're an Oxford, University of Oxford spin-out company who've got an algorithm that can generate PET scans. I think it's mainly head and neck PET scans from low-dose CT scans. And they are currently pursuing setting up clinical trials to gain regulatory approval with the FDA. So watch this space. We can see here from some of the foundational research that their algorithm is based on that it's quite tantalizing to see here that you've got the CT scans that they use to generate these PET images, and these are the actual PET images, and this lower set of images here is the image difference between the generated PET and the real PET. So although I wouldn't want to trust this now, I'm sure this is work that is going to be further developed. So we'll have to see if this comes to fruition, but we could be looking at a world where you don't need to acquire the PET data at some point. Who knows? So thank you for your attention, and I hope you found that informative and interesting and maybe a bit thought-provoking, and I hope you enjoy the rest of your conference. Thank you.